A hearty good afternoon and welcome to the session on challenges of egg freezing, benefits, and its side effects. We are glad to have Dr. Garima Sharma among us today to help us understand the topic. She will take us through that and more in this session today. Doctor, you have the stage.
Thank you and welcome all back to another Facebook Live session. And today I'm going to talk about a topic which is something nowadays, every now and then, one or two patients or girls walking down in my OPD setting question me on this topic. And that's where we thought of talking about egg freezing today in details. Now, before we jump to our topic, there was this beautiful quote of Winston Churchill which said, destiny is not a matter of chance, it's a matter of choice. And I truly agree to this, having realized that, we have seen so many advances in our technologies, so many advances in our gadget technologies, and how we are glued to this concept of changes or advances and how we modulate each every day ourselves, even to a point that we are adapting artificial intelligence in our day-to-day practice, then why not, or why shouldn't we think about the advances in the medical sector, which helps in establishing a peaceful, mentally as well as a physically healthy lifestyles, and gives you a lot of choices to balance your professional and personal life in a much better way. So, having said that, as we always start with, what do we really mean by an egg freezing? It's not a new term, it's been there since ages now. And as the term stands, the meaning is very clear. It is a procedure which gives a liberty and an independence to a woman or a girl, wherein she can preserve or store her gametes that are called as eggs, so as to plan her pregnancy to a later or a future date as per the situation is. Now, this concept, as I said, is not a new technique, is not a new concept. It has been there through decades. And this actually started to help all those unfortunate girls or women who were diagnosed with cancer and who required either a chemotherapy or a radiation therapy or both, and they were not at the right time, or they had not planned their pregnancies, or they were too young, they were single, and therefore this technique at least gave them a ray of hope, where after having a disease free or a cancer free period, they could still go ahead with the pregnancy using their own eggs. So that is when the concept of an egg freezing came, and we started labeling it as a fertility preservation post a cancer detection. Once the technology started seeing challenges with this egg freezing, in order to further refine the success rates, make this procedure even more safe. So there have been a lot of changes in last 4 or 5 decades to make this process now an acceptable, safe, and a secured and a successful process. So therefore, automatically now the horizon or the scope of usage of egg freezing has expanded. So egg freezing is being offered in other medical conditions also, especially wherein if your maternal side, that's your mother or your masi or nani, anyone has been diagnosed with breast cancers or ovarian cancers, or you carry a BRCA1 or BRCA2 mutation, which is associated with a very high risk of an ovarian or a breast cancer, or if the woman has autoimmune issues, or in her maternal side again, especially your mother or your grandmother or your masis, anyone who has had got a premature menopause, that's the period stopped at less than 40 years. And earlier, about I think a decade back, when we did not go ahead with the semen freezing in routine during IVF process, on the day of the egg pickup, if the sperms are not available, then the eggs were frozen. Over a period of time, as egg freezing was offered to for medical conditions, there was this term called as a social egg freezing, which also came into picture. And this is not again a new term; it has been there since more than 2 decades, especially being practiced in the Western world. And the social egg freezing means that you are still storing your eggs, but then not for a medical reason. So you could store your eggs for personal, professional, psychological, or financial reasons. In fact, way back in 2015, big companies like Apple and Google really started offering insurance to their women employees whereby they strengthened and even propagated the usage of egg freezing so that a woman can make a wise choice between her professional life and a personal life. Now, getting a little idea about a basic of how egg freezing came into picture and to what all aspects now we offer egg freezing. I'm sure there are a lot of questions about what the procedure is, what is the safety, complications, and the list goes on. And that's why I have been given a long list of questions today to address to all the key issues or related to egg freezing. So the first is obviously you want to know what is the procedure and how it is done. So I'll divide this procedure into three simple steps. The first is a detailed consultation with your fertility expert, wherein you discuss about your choice, wherein you want to understand whether you are applicable for this program, whether it's the right time, right age, what all are the do's, don'ts, precautions, safety, success, complications. Once you are done with this thorough discussion and you have made up your mind that you want to go ahead with the egg freezing, your fertility expert or your doctor might advise you certain blood tests and an ultrasound to understand where do we really stand with from, or where are we starting from. That is, what is your egg reserve, what is the expected success, is there any other issue that we should be concerned about that might have either a positive or a negative impact on our success rate. The second step is the actual start of the process. So, generally, on the second or the third day of the periods, your doctor runs certain blood tests and an ultrasound to ensure that there are no remnants or residuals from the previous cycle. And once that thumbs up is there, you start with daily hormonal injections for a period of about 8 to 11 days. Now, the dosage, the type of the injections, the protocol, everything is dependent on your profile as well as the choice of your doctor. The average duration is about 8 to 11 days of injections with about 3 to 5 ultrasounds in between to know where we are heading, in which direction we are growing, how many follicles are growing, at to what rate they are growing, and when are we ready. Now, once these follicles they reach a mature size, that's the last injection or trigger injection is given to accomplish the final maturation of these follicles. And after this trigger injection, 34 to 36 hours later comes the third step, which is the actual day of the egg retrieval. Now, this is a daycare procedure done under a very small anesthesia, and it is done with the help of an ultrasound assistance. The day when we aspirate the follicles, these follicles are assessed in the embryology lab by the embryologist to look for how many eggs did we get. They are kept in the incubator for a couple of hours and then they are looked for their maturity. It is only the healthy, mature eggs which are taken and are frozen for its further use. So the next immediate question comes, what is the right age for this process? Now, there is no cutoff limit. The earlier, the better. So I always say that, in your late 20s, when you know what have you made your choice in terms of your profession or your education, if you need to delay your pregnancy for about 5 years or 6 years or 10 years, you should start planning or you should start taking the help of an expert where it is better that you get yourself evaluated, look out for where the egg reserve is. Because as in how you age, so generally we say post 35, the egg quality reduces in quantity also and in quality also, and therefore the success rates of even procedures like egg freezing done at that point of time is reduced. So the whole idea is there is no limit, but the earlier the better is the key to this. With this, obviously, you would think of what is the appropriate number of eggs that you would want, or what is the number of cycles that one would want to have a successful egg freezing program. So, as there is no upper limit or lower limit for the age, similarly, there is no criteria to say that this is the number of eggs that you need for a success. But still, we generally say that a younger woman less than 35 with a good ovarian reserve, no other medical or surgical issue, it is a good idea to have about 12 to 15 mature eggs to have a successful egg freezing program. Now, in case you are more than 35 and or the egg reserve is low or there are other complicating issues, then generally about 18 to 20 mature eggs are required to have a successful program. Now, similarly, whether you are able to achieve this in one cycle or two cycles depends on the outcome of the first cycle. So generally, young women can give us decent number of eggs in one cycle only, but as and how you advance in age, you might require more than one number of cycles. Again, there's no upper limit to the number of cycles required. All that you need is that if you are engaging yourself in this program, you need good number of mature eggs. The next one is, what is the success rate? So again, success rate depends on multiple parameters. What age did you start with? What is your egg reserve? Are we dealing with a good reserve or a low reserve? Are there any other issues like PCOS or endometriosis which can impact the egg quality? What is your BMI? Are you too lean or too obese? Again, which might impact how your medications will show the response. What is going to be your egg quality? Or is there any other medical issue? Also, equally important is the expertise of your embryologist in freezing and thawing and ultimately using these eggs for creating the embryos. The next one is it a painful and does it need hospitalization? So I always say it's more about a mental pain rather than a physical pain. So the pain component is going to be there at two stages, right? One, when you're taking the injections. I understand that it's a daily injections, but remember these injections, the needle thickness is even finer than your insulin needles, and a lot of women they take injections by themselves. So someone, if a person is able to take injection by on her own, then you can understand that the pain quotient is really not there. The next thing is when you are taking out the eggs. Now, when you're taking out the eggs, the process is a very short process. It hardly takes us about 20, 30 minutes or 40 minutes, depending on how many follicles are there. And it is done under anesthesia. And again, the post-operative pain is very mild. In fact, people, they go back to their work immediately or 24 to 48 hours, depending on how they responded to the anesthesia. This is not a surgery. You're not putting any cuts that will require a lot of post-operative pain. Mental pain, of course, you are throughout till you see what's the outcome. You will be worried about how the cycle is going, whether you'll need one cycle or two cycles, what is going to be the outcome. Even after having done this, whether we'll be able to achieve our ultimate goal of having a baby, what is going to be there, right? So in terms of pain component, this is quite a very well tolerated procedure from the beginning till the end. The next one is, yeah, so people often ask me that once you have taken out these eggs, okay, for how long can you store it? And then how do you use them in the future? So with the advances in our technology and with the refinement of the freezing technique, that is vitrification that we are using now, you can safely store your eggs for almost about 10 years. And on average, this process carries a success rate of about 40 to 60%. Now, once you come back to us that you are now ready to plan for a baby and you want to use these eggs, your partner is first assessed for his semen parameters because you want to see whether you are also dealing with some sperm issue. Once you have sorted out this parameter, the embryologist will take out these eggs. He will thaw the eggs. The thaw means that you are bringing these eggs to the room temperature, and then you look out for their survival and again grade them. Only the survival, those eggs which have survived this entire process of thawing and which are mature, they are taken, equal number of sperms are taken, and they are injected. One sperm is injected into one egg with the process called as a ICSI. And over a period of next 3 to 5 days, you see how many embryos are formed, you create these embryos, and then eventually with the mutual discussion between you as a couple, the doctor, your consultant, and your embryologist, you transfer one or two embryos, and whatever is the extra, you freeze them. Then the side effects related to this procedure are very minimal in terms of if you are doing it in a very young age, you have a PCOS kind of a profile wherein you form lot of eggs, maybe more than 15 or 20 eggs, you might have symptoms of mild hyperstimulation like bloating, abdominal distension, a false sensation of a weight gain, vomiting. But generally, these are easily managed with the help of medications and not require hospitalization. The rate of hospitalization is 1 in 1,000 nowadays, thanks to the safety of our protocols that we use. Also, other side effects like mild bleeding could be there, or in terms of spotting 1 day after the procedure, and that's it. In terms of any issues or any genetic defects or risk of miscarriage related to this process. So this was a very valid question, and way back in 2013, large organizations like American and European associations, they came up with a very big statement that egg freezing is no longer an experimental treatment. Until date, now it has been more than 8,000 births from frozen eggs. There was a study with more than 1,000 births from frozen eggs, and which said that the procedure related risk of a genetic abnormality to the baby or a miscarriage is not there. A risk of a miscarriage or genetic abnormality to the baby can happen only if we started with the process very late, secondary to a poor quality egg. So the procedure nowadays is quite safe, has got a very good success rate. And in the end, I would like to say that biological aging is something real. The egg production capacity is limited. We girls are born with a fixed reserve. By the end of our 35, 40s, or maybe 42s, we are going to be depleted with egg reserves. So we should respect our nature. If you are planning to delay your pregnancy, there's no harm in doing that. But when you have safer technologies where you can preserve your fertility and avoid yourself from going through complications, from lowered success rates, from all those mental and physical uh, you know, anxieties and frustration phase, egg freezing is there to your rescue. So, with this, I'm open to all the questions that you have. Please think about this. I'm sure after thinking, you will obviously have your own set of questions. If you still feel to free, you want to connect with me after this session, you can always connect it through our official Apollo Fertility page. Thank you. Thank you, everyone.